Hey, this is Dr. Gerhardt. Just wanted to give you a quick introduction to our office. So if you're suffering from pain, burning, numbness, tingling in your hands or feet, you may have neuropathy. So in our office, we've got a complete program that can help that. So let's take a quick tour. In our adjusting room, we try to use a lot of the latest technology. So we use a computerized adjusting tool called a Pro Adjuster. This actually takes a scan of your neck and your back, tells me where the vertebrae are stuck and not moving as well as they should, and will actually let me do the adjustment with the computer. Let's go check out our decompression room. Whenever there is problems with your feet, there's always a potential that there is some nerve entrapment. So we need to make sure that all of the nerves are moving as well as they should, all the vertebrae are moving as well as they should, so there's no impingement of those peripheral nerves from your spine getting down towards your feet. So if you do have back issues also and/or disc problems, we need to use some of our decompression devices to try to get that pressure off. Not only do we need to work with your back, we've got a knee on track here, which is a decompression device specifically for your knee to remove any pressure or irritation you may be having here, because with neuropathy, a lot of times there is knee and lower leg pain as well. This is our back on track device, another form of decompression therapy that we use. This machine is wonderful. What it does is it lays back and then separates out about 4.5 inches and then shifts your lower back from side to side, just stretching those muscles down there and making sure all those vertebrae are moving as well as they should. Over in this corner is one of our red light devices. Red light therapy helps to increase vasodilation or open up those blood vessels to get better blood pumping to your feet, and also helps to decrease inflammation. Back here we have our class 4 laser that is used on some of our patients if we feel it is needed. We put some additional red lights on their knees or their feet or their back, wherever we feel it is needed. And here is what drives everything that we do in the office. This is called soft wave or shock wave therapy. In my 30 years of practice, this is the greatest device I have ever come across. What it does is, as it's firing this impulse into your body at 3,355 miles an hour, it penetrates about that deep into the tissues, decreases inflammation, increases blood flow up to 300 times, and will also help your body to release its own natural or resident stem cells to that area to treat. So as this little device is firing into your system, it is creating miracles. All right, we've got one last thing to take a look at, and this is over on the other side of the office on our nutrition center, so follow me. With programs, we know with the standard American diet, a lot of our patients have a lot of gut issues. So we've got a whole nutrition program that we can work with to help improve your gut health, decrease inflammation in your body, and just get your body tissues overall healthier. And we also use our red light device in here, which is a whole body red light system. We use 4 of these large pads and then 2 of the smaller pads. And this again helps us decrease inflammation, increase blood supply to your body, and overall help decrease inflammation. Besides, you get a nice warm 25-minute nap and it feels absolutely wonderful.